how are you? It's Dr. Ying with OC Hand Surgery. Welcome back to another episode of In Good Hands with Dr. Chi. Today we'll be talking about the lumps and bumps of the hand and wrist. I'll start with the finger mass and cyst, and then we'll go up to talk about giant cell tumors, lipoma of the hand, and end it with ganglion cysts of the wrist. So most common cysts I see from my patients are these arthritic cysts from the fingers. They're usually over the DIP joint, which is small joint at the tip of the finger. I'll show you the DIP joint is right here, and the PIP joint is the next knuckle. So the DIP joint is essentially the first knuckle of the finger. When they're small, they are frequently mistaken as sometimes as wart. So many of my patients, before they came to see me, they have already been treated mistakenly for wart. So for example, the doctors or dermatologists will try to burn it with liquid nitrogen. Of course, that's not the ideal treatment, and sometimes that can actually induce a wound. So let's talk about this type of cyst so that you know what to do when you see it. These are usually start with small red bumps, and as they start getting bigger, the skin is starting to thin. So it can look like a blister. However, these are not blisters and these are not warts. These are a type of ganglion cyst that's caused by a little bit of the arthritis in that joint. So when patients have arthritis in that joint, and most frequently they can develop a bone spur, which is a little sharp shard of bone. And when that happens, the bone spur can actually pierce the joint capsule and cause the joint fluid to leak out. That can cause the cyst or arthritic ganglion cyst formation, and your body essentially trying to contain that leaked joint fluid, pretty much forming almost a water balloon like structure. When they're small, they really don't cause any problems. However, when they start to grow and enlarge and start causing thinning of the skin, that could pose a potential problem. Because when the skin starts to get thinner and thinner, that actually will rupture. So then you end up with an open wound. In addition, because this is not a blister, this is actually a ganglion cyst that is rooted in the joint, that open wound can actually induce or increase infection into the joint itself, which could be a big problem. So when you have this type of cyst, the best thing to do is to seek out a hand surgeon near where you are and see what we can do about it. So the surgery for this type of arthritic cyst is actually quite a minor surgery. Again, most people do not need full anesthesia. We can just do the surgery under local numbing. What we do is we numb up the finger and make a little cut right around the cyst. We take the entire cyst out. In addition, because many of these cysts are caused by this sharp bone spur, we also go in to debride or flatten out the bone spur, so then a decrease the risk of recurrence. Once it's done, then we'll close you up, and usually the pain is minimal. The only restriction is to keep that clean and dry for about 2 weeks. And once we take the stitches out, and patient can pretty much go back to their normal activities. There are other type of mass in the hand and finger that's not related to the arthritis. The second most common mass in the hand are called giant cell tumors. I know it sounds kind of scary, it has the term tumor in it, but these are actually very benign. And tumor essentially just means any abnormal lumps and bumps in the hand. It does not mean it's cancer. So giant cell tumor, in contrast with ganglion cysts, they're not cystic, which means they're not a sac of fluid. They're actually solid, and they can grow anywhere. And they're a little more extensive as far as, they're usually entangles the nerve and artery a little more extensively than just the cyst. And they grow in a lobulated fashion, which means can have multiple parts to a bigger mass. And the treatment is purely surgical. So when you have a giant cell tumor, we'd recommend taking it out. Although these are pretty common and benign, we want to make sure to take everything out and send it to the lab and make sure it is giant cell tumor and not anything else that we need to worry about. Similarly, the surgery for giant cell tumor very similar to the finger arthritis cyst surgery, except it may take a little bit longer, and sometimes these tumors does involve the nerve, which means they can't stuck to the nerve. So we do have to be quite careful separating the tumor from the nerve. Even with that, occasionally the nerve does get stretched. This condition is called neuropraxia, which means patient may experience some numbness and tingling for a little bit. But the good news is most neuropraxia or nerve stretching injury will resolve spontaneous with time. The third type of mass in the hand and fingers are called lipomas. These are tumors or mass that's made of adipose tissue or fatty tissue. So these are essentially fat tumor in the hand. Most commonly, these tumors in the palm of your hand, and it can actually get pretty big, pretty sizable. Because they're slow growing, a lot of the patients ignore for a while and waited for a little bit. So these actually can get pretty big at time of presentation. So when they come to see me, it can actually be pretty big. And these lipomas, similar to the giant cell tumor, usually they're more extensively involved with the nerve and arteries. The surgery time is usually longer, incision a little bit bigger. But usually when we take these lipomas out, again, the purpose is to take the entire thing out, send it to the lab to make sure it is benign and not malignant. After the surgery, the recovery is similar to ganglion cyst or giant cell tumor, usually 2 weeks to keep the incision clean and dry. For lipoma tumors, however, majority of the cases are done under general anesthesia and not local. What are the risks for these type of surgery to take out the mass in the hand and fingers? Well, for the arthritis cyst, the risk is very minimal. Most what we worry about is like if the cyst is starting to drain already, then the risk of infection goes up. So then we usually cover you with some antibiotics. Now, when it's giant cell tumor or lipoma, again, like I mentioned before, they're usually extensively involved with nerve, artery, and tendon. So risk of nerve injury or artery injury is higher, and the most common risk is the neuropraxia, which is stretching of the nerve. However, with someone who is trained in hand and microsurgery, the risk of injury is extremely low. So once you take these mass or cysts out, do they ever reoccur? It depends on what type of mass. For example, for those arthritic cysts, recurrence rate is pretty low. Once we get the entire cyst out and take the bone spur out, the recurrence rate is pretty much lower than 5%. For giant cell tumor, because it's a tumor type of mass, and then by default you cannot get rid of every single cell that has that tumor gene in it. So the recurrence rate is slightly higher than the arthritic cyst. So for giant cell tumor, if it reoccurs, we just take it out again when it gets big enough. For lipoma, similarly, recurrence rate is there, but it's relatively low. Thank you for watching part 1 of the lumps and bumps of the hand and wrist. Make sure to tune in for part 2. And again, subscribe to our YouTube channel, follow us on social media, and visit us at ochandsurgery.com. See you next time.